Good afternoon. My name is Robin Young, and I'm the publisher of Orthopedics This Week. And here are the top 10 orthopedic and spine stories for this week, the week of April 10th, 2023. And coming in number 10 is our power rankings. This is where we survey 26 of the largest orthopedic and spine suppliers each week, and we pick out the companies which we think are the top 10 of the week. And so be sure to check that out either at our podcast or on our website, ryortho.com. Coming in at number 9 is a University of Colorado review of 30 clinical studies and collected data from 760 patients who'd undergone arthroscopic shoulder stabilization and compared those patients with 409 patients who'd been treated with external immobilization at the emergency room. The research team found patients that were treated with external stabilization, that is not arthroscopy, were 3 times more likely to have recurrent shoulder instability. Not what you want. So this is, in fact, this study, another data point supporting arthroscopic shoulder care. Number 8 story this week is a new Journal of Shoulder and Elbow Surgery study, which compared conventional static imaging with dynamic imaging, radiography, in 121 cases. Bottom line, dynamic imaging delivers more and more useful diagnostic information. The practice of musculoskeletal care has progressed in large measure because imaging has progressed. Be sure to check out this study at ryortho.com. Number 7 story this week is our profile of the Associate Professor of Orthopedic Surgery at Harvard Medical School, Dr. Antonia Chen. Every once in a rare while, a leader emerges who is in effect a surgeon's surgeon. Dr. Chen is that and a lot more. She is the author of 300 publications, 45 book chapters, and more. But beyond that, she is a true international opinion leader, again, for surgeons, and in a way that is qualitatively different than most other opinion leaders. So we are profiling Dr. Chen this week, and she discusses a bit about her research interest and, importantly, talks about her current research projects. So be sure to check out this really fascinating profile. Our 6th story is about Paul Tornetta. He's the chief of the Department of Orthopedic Surgery and director of trauma at Boston Medical Center. And he is the first vice president of AAOS. Now, the reason that matters is that means he is set to become the president of AAOS in 2024. You know, AAOS, which is the largest largest surgeon orthopedic society in the world, has a magnificent track record over the years of really finding and promoting extraordinarily talented leadership. So this is a good piece of news. Our 5th story is news, and this is interesting. A research consortium, MERTC, which stands for the Major Extremity Trauma Research Consortium, based in Johns Hopkins University. They are the 2023 winner of the Kappa Delta Research Award from AAOS. The award is for research excellence, and MERTC won it for a 34-study research platform. And I think they have 70,000 patients in that platform, which is really incredible. And they address issues related to the evaluation and treatment and recovery after extreme extremity trauma. Really good stuff. And coming in at number 4 is a fascinating study out of both Israel and the United States that found evidence that real-time biofeedback and behavior training can lead to substantial, not modest, not incremental, substantial back pain relief. And it comes in the form of a smartphone app. Sign of the times, perhaps an indicator of what's coming in the future. The study appears in the peer-reviewed journal Frontiers in Physiology. We've said for a long time, innovation in pain management is one of the great frontiers in orthopedics. So be sure to check out this story at ryortho.com. Coming in at number 3 is news out of Duke University that scientists there have discovered a new biomarker for osteoarthritis, which has the potential to significantly improve our ability to predict the onset and severity of osteoarthritis. It's very cool news. Be sure to read all about this discovery at ryortho.com. Number 2 this week is a massive 12,000 patient study from the University of Massachusetts Chan Medical School, where the researchers matched total knee arthroplasty outcomes to demographics. They found, interestingly enough, along with a lot of other data points, that older patients, defined as patients 75 years of age or older, had better outcomes from their knee arthroplasty than younger patients, which were defined as patients 55 years of age or younger. Fascinating, right? Be sure to check it out at ryortho.com. And our number 1 story this week is a truly milestone study that dispels one of the most pervasive stereotypes about surgeon burnout and reveals what may well be, the most important cause of burnout and offers some interesting advice. Roughly 30 to 40% of all orthopedic surgeons at some point in their career experience burnout. The problem has been historically framed in terms of the individual surgeon. That's actually incorrect. According to this new landmark study that appears in the Journal of Pediatric Orthopedic Surgery of North America, the greatest contributing factor to surgeon burnout is the hospital or clinic system they work in, much less so than the physician themselves. Furthermore, simple and a few not so simple systemic changes can powerfully and reliably reduce rates of physician burnout. This is a must-read article. I hope everyone checks it out. And those are the top 10 stories in orthopedics this week. Be sure to read these important stories and many more at ryortho.com. Thank you all very much and have a great week.